Hello everyone, welcome back to our channel Pathomed. In this video, we are going to discuss about the academics in MD Pathology. Each one of you will have a residency period of 3 years, after which you are going to appear for your final examination. Before you appear for the final examination, you have certain prerequisites to complete that makes you eligible to appear for this final examination. So, the prerequisites are firstly, you have this logbook entry. So, in your each institution has a separate logbook. You will have to record all your daily activities in those logbook, like on a daily basis, what all slides you do, what all reporting you do, what all peripheral smears, the fluids you see, or histopath slides you see, or what all procedures you perform. All those will be recorded. You have to make a record on a daily basis in this book. And at last, you need to get it signed by your faculty members and submit. This makes you eligible or appear for this final exam. This is one of the mandatory things. The other mandatory thing is poster presentation. Poster presentation. Mostly we do it in the first year itself because it's a very simple and a small thing to do. Poster presentation you pick up a rare case with an incidence of less than 2% worldwide that you get in your college. This case should get in your own college and incidence rate should be less than 2%. That you make a poster with the help of your faculty. My poster topic was eosinophilic solid and cystic renal cell carcinoma. It's an incidence rate of less than, I think it's 0.2%, one of the rarest case and newest entity of the renal cell carcinomas as per WHO. So luckily I got this topic and have made a post presented it at state conference at Mamata Medical College. Other thing is, yeah, this is my poster. Eosinophilic solid and cystic renal cell carcinoma. It's a rare case presentation. I'm the principal author. You will have your co-authors, that is your faculty at your institution. With the help of them, you pick up this case, make poster, click images, and what all required. I mean the details about this topic. You give an introduction that is the rarest with an incidence rate less than 2% or so and so. Just a brief introduction regarding that case and the case report, the case that you received at your department. You have to give a brief about the case report of that patient and you discuss about this case. A good discussion about this case, any IHC markers that you use. In this case, I have used this Paxate IHC marker. And conclusion, finally the conclusion. And you add this gross images. I have put some gross images that I have received at my department, gross images, and the microscopic images. And the findings on this HND stain sections I have included. This is my poster. Uh, at the state conference which I attended, they have given certain guidelines like the measurements of the poster. For me, it was 1 by 1 meter. And at few high-end centers, they provide e-posters, that is electronic posters that can be displayed. But for me, in the conference which I attended, they recommended flexi poster, so I got a flexi printing of this. This I have done in my first year. Other thing is paper presentation. Mostly in our institution, we do it in the second year. But anytime before your final exams, you need to get completed all this. Paper presentation is like a mini thesis. It is a junior thesis or a mini thesis. For example, if thesis is of 100 pages, this paper will be of 20 pages. It's a mini or junior thesis. The frequently encountered cases in your institution so that you will get the specimen size or the sample size will be more. The more number of cases that you include, then it's beneficial to you. So you can conclude in so many patients I've seen so many findings, hence this is proved. Like that you can do a paper presentation at a state level or national level conference. And other, most importantly, thesis or dissertation. This you have to do over a period of 3 years and get it approved before 6 months. Submit and get approval 6 months prior to your final examination. I'll discuss about thesis in detail in our next video. After you complete these things, you get unlocked. That means you get this eligibility to appear for the theory final examination, theory and practical. So now coming back to this theory examination, the theory examination consists of 4 papers. Each paper has 10 essays. So in total 40 essays you have to write. In paper 1, it deals with general pathology, that is 1 to 10 chapters of the Robbins general path. For example, first chapter is a cell as a unit of health and disease, cellular injury, adaptations to cell death, inflammation, genetics, immune system, neoplasia, etc. The first 10 chapters are covered in general pathology, first 10 chapters of Robbins. In paper 2, it deals with systemic pathology or special pathology, like all the organ systems, like cardiovascular system, respiratory system, genitourinary system, male, female reproductive systems, liver and biliary tract, gastrointestinal systems, all this, etc. All these organ systems, their benign and malignancy conditions, morphological features in detail, you will have to study in paper 2. Once general pathology are well versed with general pathology, systemic pathology becomes a cakewalk to you. And the systemic pathology includes chapter 11 to 29 of Robbins' 10th edition or 11th edition. Paper 3, it is to do with much of laboratory medicine, that is hematology, clinical pathology, cytology, chemical pathology. The books for this I have discussed in my earlier video. You can refer to that. And paper 4, it deals with recent advances. That is recent advances in all the above topics. Paper 1, 2, 3. In all these topics, what all recent advances have been made till now. It is covered in paper 4. So, in our next meet, we shall discuss about thesis. I'll tell you in detail about my experience, about how I chose this topic and how I got approval for this topic, and my ethical committee approval at my institution. What was my experience with the ethical committee, and also about the practical exams. And also I'll make videos of each theory paper topics like the previous year questions or most frequently encountered questions in each 4 papers. I'll make videos of it and share with you so that you and me can learn together in our coming videos. If you find this content helpful, please like, share, and subscribe to our channel Pathomad. Thank you and have a nice day.